So let me focus on conductive disorder. First of all, I want to share what it is. So conductive disorder, we refer to a group of repetitive and persistent behavioral or emotional problems in youngsters. The children and adolescents with this disorder have a great difficulties following the rules or respecting the rights of others. And the baby or adolescents or young children who have this problem, they showing empathy or behaving in a society not accepted the way. So here we are going to focus some behavior problem and also what are the risk factor and what are the nursing intervention. As I told you, the conduct disorder is the persistent behavior in the children or adolescents and that violate the rights of others or disregard the other norms. So the conductive disorder most common in the young children or adolescents and we categorized mild, moderate and severe. The moderate or severe when it violates the right of others. So very aggressive to, towards the others or animals, destruction of properties, or very serious violation of rules. What are the other common manifestation? They physically they like to fightings and during the fight they like to use the weapon. They bullying or threaten to others. They like to stealing and physically abuse to the peoples or animals or force others into sexual activities. They lies or breaks the promise often. So before 13, they roaming away or running away from the homes, they breaking and entering the homes. Every sign and symptom begin before age of 13. They lying, they theft, and also run away from the homes, we said. So what are the other or what are the risk factor? Usually genetics or organic factor like brain damage or some biochemical factors, even psychological factor related this like child abuse or dysfunctional family, parents who abuse the drugs or alcohol or properties. Some patients give the history of neglects or abuse by the parents. Large family size, one of the important risk factor, or lack of supervision, difficulty the uh, temperament as baby, right? So this is the underlying risk factor of conductive disorder. So what are the intervention? So nursing intervention are work to establish a trusting relationship with the child and be sure to convey that you accept him or her. Provide the clear behavior guidelines, including consequence for disruptive or manipulative behavior, or talk to him about the making acceptable choice. Teach him effective problem solving skill, and also have him demonstrate them in return. Help him identify the personal needs and also identify ab- abusive communication such as threat. So it is the blockage of communication, encouraging the child to stop using them. So the first priority to reduce the environmental stimuli, use the claim, also firm approach, provide short, clear expectations, and set the clear limit for behavior. Also incorporate physical activities to help the child use the energy. Model or reward acceptable behavior. And now we have to go focus about the treatment option. So behavioral therapy is the most important to change the children. Also, cognitive behavioral therapy can help. We have to know how to anger management, because anger and normal feelings is an emotional response to frustration, right? So if it can be positive, if there is a truly an unfair or wrong situation that need to be right. But anger sometimes become negative when it is denied or suppressed or expressed inappropriately, such as by using aggressive behavior. Deny or suppressed anger can manifest as a physical or psychological findings as well, like headache or hypertension later in life. So we have to know how to manage the anger, how to manage the stress. Otherwise, stress can cause so many problems. Social skill training, social education program, also parents management training, functional family therapy, multi-systemic therapy, or integrated approach by family or teacher, management of any coexist problem. And definitely, if it is very severe cases, we will give the medication, psychotherapy, or uh, medication for ADHD, if any. So if you know how to underline cause, just remove it. So this is the very basic information about the conduct disorder. And here we learn what are the conduct disorder, what are the risk factor, what are the manifestation, right? And also nursing intervention. All is need for NCLEX board.